Hi, I am Dr. Abhaya Kumar S M, medical oncologist at Manipal Hospital Whitefield. So today I am going to talk about metastatic breast cancer. So metastatic breast cancer means it is an advanced breast cancer, stage 4 breast cancer. So technically speaking, any metastatic cancers are not curable, but with present available therapy, so on an average, this patient can survive more than 3 years, and it can range from few months to many years also. So we diagnose breast cancer by doing a biopsy from any lump. So patient might present with lump in a breast. We do biopsy. We take a tumor tissue through the biopsy and we'll see under the microscope and we diagnose the breast cancer by doing a imaging. So imaging, ideally we do PET CT scan. The breast cancer might spread to bones, it can spread to lungs, liver, other lymph nodes, and also in some patients to the brain also. So first initially our aim is to diagnose by doing biopsy, then stage it by doing an imaging, especially PET CT scan. So by these two things we come to know the staging evaluation. What is the stage of the disease? So we are traditionally moving away from chemotherapy to more and more targeted therapy, hormone therapy in breast cancer. Earlier we used to give our breast cancer chemotherapy. So now we are assessing some targets which are expressed on the malignant cells, that is estrogen receptor, progesterone receptor and HER2 receptor. So what we traditionally call it as ER/PR and HER2. And also we do PD-L1 testing, so which are expressed on the tumor cells and also immunological cells. So in patients, we classify based upon these tumor markers, like if patient is expressed ER/PR positive or HER2 positive or all three are negative, so which we call it as a triple negative breast cancer, and hence the treatment depends upon these factors only in metastatic breast cancer. So if a patient is ER/PR positive or HER2 negative, we usually treat these patients with hormone therapy plus targeted therapies, that is what we call it as a CDK4/6 inhibitors. So there are 3 CDK4/6 inhibitors like abemaciclib, ribociclib, palbociclib. We combine them with hormone therapy. So traditionally we used to treat these patients earlier with the chemotherapy. So now because of availability of lot of targeted therapies which works better than the chemotherapy with lesser side effects, with oral tablets which can be tolerated well, we are able to treat with these tablets with a prolonged period of disease control. And similarly, if a patient is HER2 positive, so we use anti-HER2 targeted therapy. Again, traditionally earlier we used to give chemotherapy for everybody. So now we give chemotherapy along with the anti-HER2 targeted therapy initially for few cycles. Then we start the chemotherapy and continue patients on a maintenance with targeted therapy, that is anti-HER2 targeted therapies. We have a multiple again anti-HER2 targeted therapies. First line we use chemotherapy with combination of trastuzumab and pertuzumab. So if patient fails on this therapy, so we can use second line, we use TDM1. So third line we use TDXT. And nowadays again newer medicines have also come up like tucatinib, which are used in the later lines of therapies. If a patient is all 3 negative, ER/PR, HER2 negative, we call it as a triple negative breast cancer. So in this triple negative breast cancer, we don't have any much targeted therapy available. So in this here, we use immunotherapy. So we call a test called as a PD-L1 test. If the PD-L1 is positive, we combine chemotherapy with immunotherapy. So among all these patients in the metastatic breast cancer, ER/PR positive patients are a very good group of patients where with the availability of targeted therapies with the hormone therapy, we can control the disease for very prolonged period of time. Next comes the patients with HER2 positive group. Again, there are availability of multiple anti-HER2 therapies in the first line, second line, third line, fourth line. We can control again their disease for prolonged period of time. So and again in the patients with triple negative, among all the metastatic breast cancer, these triple negative breast cancers are not a good group compared to the earlier. Now with the addition of availability of immunotherapy, we are again controlling this disease for prolonged period of time. But overall outcome is not very great compared to the patients who are ER/PR positive and HER2 negative.